As a teacher, I'm fortunate enough to have pretty good health care. Decent insurance, which is a good thing. About 9 years ago, I was diagnosed with a giant pituitary tumor, and if I didn't have insurance, I would have died. The surgery was incredibly expensive, but it saved my life. And fortunately, I've got very good coverage as a teacher, as a member of a union. Now, I know there's a lot of people out there who don't think that teachers should get health coverage. I know there's a lot of people out there who hate unions. Okay, that's not what this is about. Today we got an email from some members of the staff that one of our substitute teachers just had emergency surgery done. And being a substitute teacher, he doesn't get health insurance. He also has a chronic condition, a pre-existing condition, which basically makes it impossible for him to get affordable health insurance. So they've taken up a collection. They've asked people to donate towards his care. Let me ask you something. If you didn't have insurance, would you really want to rely on the charity of others to help you out when a situation arises like this? Do you really want to rely on charity to decide between bankruptcy or death? It doesn't seem like a fair question. And in a country as supposedly civilized as ours is, and as advanced culturally and technologically and politically, why is it that we haven't figured out yet that healthcare is a right and not a privilege merely for those who can afford it? Why do we allow insurance companies to make obscene profits on the pain and suffering of other people? Why is it that we're the only country that hasn't gotten it yet, that a single-payer system is the only way to go? Now, we all know that both Democrats and Republicans are basically in the pockets of the healthcare corporations, including the insurance corporations, and that deals have been cut that basically make it politically impossible to even put a public option through for President Obama. But that's not helping. The healthcare plan that was passed by the House, and then the different version that was passed by the Senate, and now they want to pass a reconciliation bill to, close the gap between the two. Those amount to putting a Band-Aid on a chopped off leg. It's not going to do any good. All right, you're going to stop a little bit of the bleeding, but the rest of it's gushing out. You're not solving any problems here. All right, a few more people are going to be covered, or if they can't afford to be covered, they have to pay a penalty, which means they're going to be unable to even pay what health bills they have. Single payer. Look, I don't understand why we haven't gotten it yet. The Republicans keep screaming that the Massachusetts election was a referendum that we don't want health care. No, that's not true. We do want health care. We just don't want it done the way it's being done. We don't want these deals. We don't want mandates. Not of this nature. Everybody should be covered. Universal health coverage. What we need to do is take a look and see how countries that already have a single-payer system are doing it, and incorporate the best parts of those systems. Eliminate private health insurance as the main method of financing healthcare. Other countries have a value-added tax. What's wrong with that? You're spreading the cost throughout the population, and therefore you don't need mandates because everybody's going to be paying towards it. All you need to do is buy stuff, and the value-added tax, well, that part of that gets kicked back into healthcare again. Now, Medicare isn't perfect, but it can be retooled and applied to everyone. This substitute teacher is one of the most talented people that I know. He is amazing with the kids. He is the person you want to cover you when you're not going to be there. Whenever I'm not going to be there, which is about once a year, I always ask for him in advance because I know he's going to get the job done. He's going to do a great job with the kids. The kids respect him. He can come into any situation and handle it with ease and an absolute grace. He is amazing. And yet, because he's a substitute, he doesn't qualify for health care. Now we're going to contribute to help him out. But the point is, we shouldn't have to. We should all be contributing for the greater good. We need a single-payer health care system because what we're doing right now isn't working, and what's being proposed is nowhere near enough, and it will not solve the problem. Thank you.